I am going to welcome my panel members to the stage. But before we meet our panel members today, we have a very important guest, and that is Jenny Pearson, who is part of the Relay Network nationwide. But today, Jenny, we're specifically focusing on a program with Pennsylvania Relay. Uh, First off, a lot of people are not familiar with the relay systems. So give us a little overview of this amazing program.
Thanks, Steve. Can you hear me okay?
Yeah.
Okay, great. So yeah, Pennsylvania caption telephone relay services are available for Pennsylvania residents who have difficulty using a telephone. This program is administered through the Pennsylvania Public Utilities Commission, and we are able to provide caption telephone service for folks who are hard of hearing, who need that extra assistance where they're not maybe able to hear 100% of the conversation, and they would need those captions to be able to make and receive phone calls. And through our program, we can provide caption telephones to those that need it at no cost. This service is also free. The only thing that you would pay for is your phone bill, which is you're paying for that anyway. And we can provide setup support. We can also provide training on how to use the devices as well.
I love it. And I'm glad that you brought no cost. And this is a benefit that all of us, when you're spotlighting the Pennsylvania Relay program today, but am I correct that every state in the country has a relay program?
Yes, that is correct, Steve. It's part of the Americans with Disabilities Act that makes pretty much life accessible for folks with disabilities. There is a component of that that ruling that says that telecommunications has to be accessible. So we're talking about programs like you may be familiar with TTY services or text telephone services. That was for a long time a lifesaver for folks who are deaf. So we do provide those services as well, including services for folks who have speech differences. So think someone who is maybe using an electronic voice box. They may not be understood very easily over the phone. We can provide speech-to-speech services for those folks so that they can also make and receive phone calls.
Man, this is great. And isn't it crazy how you've got a program that is absolutely free to the consumer, and you have to get out there and scream this from the rooftops? It's well, I'm glad that we're one of the rooftops that you're screaming from, and I'm really hopeful that some of our community members and people that are listening to this recording reach out to you and the team at PA Relay or any of the relay systems throughout the country.
Yeah, absolutely. And Steve, I'm going to put my contact information in the chat. So if anybody wants to speak to me after the webinar or offline, I'm happy to answer any questions anyone might have.
I love it, Jenny. Anything else that you want to share before we kick off our discussion?
No, I don't think so. I want to thank you so much for your time, everybody. Thank you for your time. Ladies, it was great hearing you chat offline. So have a great chat, and I'll be here in the background.
Love it. All right. Okay. Well, folks, that's an amazing program that that a lot of people don't know about. So definitely access that if you know somebody who's hard of hearing. And now I'm excited that we are going to jump into another roundtable discussion with aging life care managers. And first off, let's get to know the three of you, and then we'll make sure that we talk a little bit about what your profession is before we dive into the to a roundtable. So, Joanne, I'm going to start with you. Tell us a little bit about yourself and the organization that you represent.
Thanks, Steve. My name is Joanne McCarty. I am a registered nurse. Next year, I will have been a nurse for 40 years, so it's definitely something I'm passionate about. I work for a company called Independent U, which is located in Fairfax, Virginia, and we are celebrating 15 years of business this year. We do caregiving as well as geriatric care management or aging life care professionals. We have a very well-rounded team of nurses, social workers. We have one OT, and we have somebody else who's got a background in administration, and we are all real passionate about what we do. This is a great forum to be able to talk with some of my peers and share some information with you.
Thanks, Joanne. Well, Karen, how about if I go to you next? Also a bit about your background and your organization.
Excellent. Thanks, Steve. Hi, I'm Karen McPhail. I'm the CEO for Elementals Care Management. We provide RN care management services. Our hub is really the Northern Virginia, DC metro area, but we also provide care management either on-site or virtually in any multi-practice state across the country. I went into care management because I really felt a call to action. I'm someone who has a background in not only long-term care, but also acute care, and felt that I could make a difference for others through advocacy and other work in this field. We, again, provide RN care management, but we take a multidisciplinary approach. We do anything from long distance relocations to complex care and guidance and support, because oftentimes most of the issues when you're aging or have complex care are clinical in nature. People count on us to know the answers and to be clinical experts, and we try our best to really do that every day. So that's just a little bit about me.
And Colleen, also a little bit about you and your practice and your background.
Super. Thank you. Thank you for having me. And thank you to the audience for joining us today. This is exciting. My name is Colleen Ceh Becvar. I'm a gerontologist, and I own and operate a firm out of Illinois, the suburb of Chicago, called Oak Brook. And we are a little different than, I would say, some care management companies in that we do the traditional geriatric care management, aging life care management. But on the other side of the business, we are also professional decision makers. We will be powers of attorney. We will be guardians. We will be executors, etc. So we have both the financial piece and the care management piece. As far as my background, I've been an advocate for seniors and their families for over 30 years. We are celebrating 10 years in business here just outside the Chicago area with 10 people on staff and growing, I'm excited to say. So thank you for having me.
And Colleen, since I'm on you right now, there's always folks in our audience who are listening to the recording who've never heard of this profession, aging life care, or know about the association, the Aging Life Care Association. Would you like to take a crack at sort of an overall definition of the profession? And while you do that, I'll drop in what they've got on the Aging Life Care website as well.
I'd be happy to, Steve. And I would say, first of all, that you are not alone if you have not heard of this profession. I think that is one of the key points that I rely on as a geriatric care manager is my professional association, Aging Life Care Association, to not only help people find me, but I also use Aging Life Care Association to find professionals like me across the country. And the role of an aging life care professional is to be that local expert on the continuum of services that are available to people over the age of 65, technically in my gerontological mind, but really it's not just people over the age of 65. But these are folks who are experts who come from multiple disciplines. You've already heard some of my colleagues this afternoon talk about their clinical backgrounds, and that they also invite occupational therapists, speech therapists, physical therapists to the forefront, gerontologists, social workers, nurses. I mean, these are people who are dedicated to the profession. And I think what makes Aging Life Care Association unique is anybody can really throw up a shingle and say that they're a geriatric care manager, but Aging Life Care Association is the only one that has published ethics, standards of practice, and they are dedicated to education. So we are head and shoulders above other professionals out there who might go by the same name. So I hope I did us justice, ladies who have joined
That's a
me.
great, that's a great definition. What I like is, on these discussions, there's one aging life care manager that calls herself, we're like wedding planners for growing older. And then somebody else in this discussion said, well, I'm like the quarterback for making this decision.
Yeah.
And the last one that I heard that I thought was cool, it's like I'm your wingman. I'm your wingman or wing person, I guess, in these days. Now, before we dive into our discussion, I want to just do a quick demo for folks on the Aging Life Care website, and it's aginglifecare.org is where you land, and you can find all the details and lots of great stuff. But what I really want to spotlight is this orange button at the top. It says find an aging life care expert, and what you can do is just throw in any you can throw in any zip code, and just because I'm on my computer, I'm just going to use my zip code there. And what you'll see is that a bunch of providers will come up, and it doesn't matter where you are in the country. There are aging life care managers that are close to most of us. So, anyways, with that, let's dive into our discussion. Oh, okay. I just got something that my audio is, you know what? Thank you for letting me know that, because I think, hopefully, do I sound a little bit better now, folks?
Yes.
Okay, sorry. Thank you, Ivy, for letting me know that my audio was unclear. Okay, here we go. Now, the best part about these is you all can ask questions. You can share your resources, things like that. So use chat, use Q&A, and we can include you in the conversation today. So I'm going to jump back to Joanne to kick things off for a roundtable. Joanne, what's on your mind these days? What are some things that we could be thinking about here?
So this sort of backs up to what Colleen was saying. The beauty of the care management network across the United States is that I have a daughter who happens to live in Chicago who's an MSW, and she called me the other day because she works in a hospital in the neonatal intensive care unit. And she thought that one of the people that she works with, the family, she not only works with the babies, but she works with the families, and they had a premature baby, and the parents were dealing with all this crisis, but they had their parents or the grandparents of the baby that also had some issues. And the parents in that sandwich generation that we all deal with every day, she thought, oh, my mother's a care manager, maybe they need a care manager. So I explained the website, and I said, give me the zip code of where the people live. And I gave her the zip, I put it in, and I found several people looking at advanced professionals, looking at a social worker rather than an RN, because that's kind of what she was thinking. And it's just, to me, it's like an amazing thing. Like we get asked so many different questions, and most of us will always do our best to answer, even if it's not us that are going to be the care manager. But if we can utilize our network, we, as members of ALCA, we choose to be members of a national organization. We choose to be certified, to take an exam, to be true to our standards of practice and our ethics. And that to me says a lot about the people that are part of the Aging Life Care. So I don't have to know somebody in Chicago, although now I know Colleen. But I think I can go on, and I've done it many times in New York or California, and called up the people and just say, hey, I'm, Joanne, I live in Fairfax, Virginia. I have a client who lives in Pennsylvania. they're looking to hire, and we just do a professional exchange, and it makes it's we're all one, big happy, family, not only in
And
Northern Virginia, but all over.
one of the things that I know that you all love about going to your national conference, if you can fit it into your schedule, is the opportunity to meet face to face with care managers all over the country, just for that reason that if somebody in a certain geographic area is looking for something, it's like, oh, I know Colleen in Chicago. Let me just reach out to her direct and connect the two of you. So that's great. Now, Karen has a question. How is an aging life care manager different than a patient navigator or a care advocate? Um, uh, Good question, Karen. Curious how the panel would answer that.
I would say, and this is Colleen. Karen, we were talking with Karen McPhail offline, and I really feel like this dovetails very nicely, Karen, with what is on your mind lately. I will just briefly say that I think what you've described is, as far as a care navigator, that certainly comes under the umbrella of what a care management can do, and certainly patient advocacy. We do those things. That's one of the things that I think we are, that doorway to walk through all of those services. So, but Karen, I know that you had some very interesting thoughts on that too.
Yeah, whoops, go ahead. Yeah,
No, I was going to say, Karen, take it away because I agree with Colleen. I think you were going to share some patient advocate journeys with us here.
yes. Yeah, I think, one of the biggest pieces that I'm seeing as a care manager that's evolving, and I guess I've been doing this, I've had my business since 2001, and then I've seen a lot of changes, but I see the growing need for medical advocacy. People need advocates and people to guide the way. People are living longer, care is more complex. It's costly. Mistakes can be made without people really understanding. So, I think looking at aging life care and an aging life care manager is a little bit, I think, more than some of the traditional, like, for example, the Medicare Guide program has navigators, and they do certain aspects of sort of navigating the dementia journey, focusing on the caregivers. We're a little bit different because we focus on holistically the individual and their family. So, we're trying to make sure that we're, helping people across the entire continuum. I see a lot of medical advocacy needs in acute care settings when people are at the hospital, especially for people with complex care, dementia, and movement disorders such as Parkinson's, because the care is complicated. We're not teaching perhaps as well as we should be in medical school and nursing school. We're not having those patients accessing the ER. So having a knowledgeable party, a clinical expert, someone who understands the full continuum and resources, I think really helps in that regard to help people to be really navigated forward. We oftentimes provide 24-hour access to care support, which isn't always a part of a traditional navigator service. So I think, to answer the question, now that I'm circling back a bit, I think aging life care managers oftentimes provide a little bit fuller, more encompassing than just traditional navigation for, perhaps relocation or an aspect of advanced care planning.
I usually
Great.
associate like the navigation piece is people that are looking for relocation, like to move from home to a community. And they're fine at what they do. They may be certified. They're usually just situational. Whereas what Karen was saying is that I've had some clients that I've worked with for 9 years. I've had clients that we worked with their parents, and now we're working with their parents when they were 90. Now their kids are in their 70s, or their aunt who lives somewhere else. So it's really becoming, like Steve said earlier, about being described as a wedding planner or a quarterback. We're like another daughter. You know, we are part of that team. People ask us, I mean, in such a short period of time that you get to know somebody, we're involved in all the family dynamics. We know which sibling doesn't like that person and can't trust that person, and you know, who does the lion's share of the work. We end up learning about finances and grandchildren, and you know, who's going to take care of the cat, all different kinds of things. It's amazing to me sometimes when I'm, you know, working with somebody for a short period of time, how people take that time to trust us. I just saw something that popped up about certification. You don't have to have a certification to be a care manager. Um, I think all three of us are certified. We expect in my company that, you know, after 2 years you're going to be certified, and it's another sort of checklist, because we are making decisions on health, which is huge. We're giving people advice about end of life. You know, should I be a DNR? Should I go on hospice? We're giving people advice on finances, not, you know, finances like, you know, the stock market, but, you know, if I've got this pot of money, where can I go and how can I make that last as long as it can? We can, you know, make referrals to people that can help you. We have very big toolboxes full of great references, communities, doctors, social workers, you know, podiatrists that come into the home, all different kinds of things. It's an ongoing art that we do.
Yeah,
I love it. Yeah.
and I think along those lines, another thing that honestly is a big issue is the collaboration of care and transparency of information exchange. I think having a care manager who is really that clinical expert and that clearinghouse, like Joanne's saying, that person that knows every aspect holistically about you and the, you know, your family, really helps to keep everyone on track and to keep things moving forward. And to be honest, what is most paramount is really also keeping things moving forward in accordance with one's expressed wishes, and valuing that and having someone that understands. And again, circling back to what I originally had said, the medical advocacy piece, which is critical across all areas.
All
So
right.
thank you for, oh, excuse me, Steve, go right ahead.
Oh, no, we've got, let me make sure that I address some of the comments related to what we're talking about. Let's see. Okay, Karen, there's another follow-up here. This is Karen in the audience. Are you following clinical guidelines and treatment protocols with healthcare providers and systems? All three of you can comment on that one. Yeah.
I'm happy to take that one. Absolutely, we are. And I think that one of the things that is an important boundary that all responsible professionals and again, our standards of practice teach us this and enforce it. That when you're working with a physician, for example, and to use Karen's example a moment ago, my colleague, about it's really giving voice to that client and what the doctor might recommend, and everybody else around that medical team might recommend a very specific outcome or a very specific treatment that our clients are in direct opposition to. And it is not always the popular line that we have to toe, but it is the client's voice that we are responsible for echoing to that family member, sometimes to the religious leaders, sometimes to the ethical the pushback that the client may get. And we understand that. But our job and our loyalty is to the client, him or herself. In terms of, do we follow the treatment plan? Of course, and I'm not sure that I heard that correctly, Steve. So I want to be very careful about my language, and I don't want to put words into the mouth of
Here, it's are you following clinical guidelines and treatment protocols with healthcare providers and systems?
Yeah.
The short answer is yes. Yes, and yes, of course we are. And we're not here to blaze new trails and treatments, but we are here to help explore beyond mainstream treatment options. So go ahead, Karen.
Yeah, I think also, there's times when, we're providing additional information and advocating for our clients. For example, if there are research protocols or things that perhaps we don't feel a physician is mentioning that really, would be important for the family to know, we're of course adding additional. I have additional training as a nurse practitioner, so I'm a little bit different, but I stay in my lane as a care manager. I'm not practicing as a practitioner. But along those lines, yes, we're sticking to protocols, but we're collaborating. For example, we work with hospice organizations all the time. But when I'm rounding on one of my clients and I'm seeing that the orders are not working for that individual because they're having progression or changes, I'm then taking that back to the team and advocating for changes to be made to support their comfort, their well-being, and their expressed wishes. So it is something where we're really working across different areas, and it's very multidisciplinary, collaborative, and transparent, if that makes sense.
I think one of the other things is that people wait too long sometimes to have an aging life care professional involved with their family. And we get asked that question quite often is, when do I need a care manager? And you might not ever need them, but it's good to have somebody just in case, your significant other or your kids take a vacation and they want someone to check on you at home. We do a lot of just assessments and we have everybody's information. We get to know what their wishes are, and that helps us kind of plan for things like when would they need to relocate or when would they go on hospice. And when they do go on hospice and need decisions made, we want to know what that individual, our client, wants, because we are, again, that we use that word advocate all the time. We can say Mrs. Smith, wanted to be cremated, or she wanted, this Bible verse read at her funeral, or this was really important to her. She wanted to stay home for a long time. I had my first care management client. I ended up, helping her plan her funeral, and she loved the color purple. So, she had a purple walker, she had a purple cane. I had a purple blood pressure cuff for her. We had purple flowers. It was just not to take away decisions from family, but a lot of times we are that person because their significant others or their support systems are not local, or they are, like Steve mentioned earlier, the solo ager who doesn't have somebody else.
Yeah.
And on that note, if you guys look at chat, Jonathan says, my favorite term for aging life care managers is paid daughters. And he's a solo ager in Southern California who just hired an aging life care manager to create a much needed safety net. So, Jonathan, I like that. I'm going to add that to my list of little acronyms, paid daughter and son. But thanks for sharing how you're using a aging life care manager proactively. Yeah, Karen.
Yeah, I wanted to add to what Joanne was saying, that people do wait. And we do a ton of advanced care planning for people. And we really recommend that if you are solo aging, have distant family, complex conditions, or honestly, if you're really planning, for your retirement 55 and above, it helps to just have a care management evaluation done and to do an advanced care plan. So you get sort of your express wishes down on paper, and you have a chance to ask questions and find out about things you've never known are available. And then if something happens, we're sort of that insurance policy that's sitting. And if there's a bump in the road, we say, hey, we're here. We know the plan. We talked about this. And then we create stability and keep things moving forward. So I think, what Joanne was saying, I wish more people would, as a part of planning for the future, realize an advanced care plan with an aging life care professional is a critical piece, in addition to their traditional, advanced directives, will, financial power of attorneys.
I would add to that, Karen, that when, a lot of times people don't know that we exist, which is why we're so grateful for this forum, Steve. So thank you so much. But I think where most people are getting their information, unfortunately, is through online resources, through search histories. And who wouldn't do that, right? That's how so many of us are doing that. I think the unfortunate thing about that is what cannot be leveraged through an online search is the experience that geriatric care managers bring to the practice, bring to the assessment. And that is one thing to sort of build on what Karen and Joanne have both stated. We look at things here at my practice, we call it the 4 stages of care management. And people usually fall into one of these 4 categories. You're either in crisis, and that means you need something now or within 72 hours. Then the next phase would be stabilization. Do you have food, clothing, medications, and shelter, of course? So that's really, a lot of our work, I think my colleagues would agree, works around this stabilization piece oftentimes. And then once that stabilization happens and we've created this environment of stability, then we move on to the 3rd phase, which is quality of life. And I think that's where a lot of people and well-intended family members go, oh God, thank God. Okay, everything's taken care of. We've got everything we need. And now we can kind of put it into neutral. And I have to disagree with that mindset, because now that we have this plan for elongating people's lives through medical treatments and these supports, what makes life worth living for that client? And that's another really beautiful part of this work, is then bringing in the programming around the clients. And then once we've got the quality of life pieces in there, that monitoring. And so I think, Karen, that goes back to what you were talking about. We might come up with this wonderful assessment, and that this assessment answers some current questions, and maybe everybody's bobbing along, and that looks great. But what about those hiccups? What about those highs and lows? What about that destabilization? And that we can, as care managers, step in at any point along that continuum and really be very, very helpful.
Yeah.
That's cool, Colleen. I like how you described that timeline there, and that was very helpful.
Good.
Let's see. Okay, Aaron. Okay, let's see. The incredible Gregory Hunter says, is there a high, medium, or low turnover of rate of people who take on this unique type of service relative to caregivers in general? You know, Greg, because I've been doing this for 35 years and had relationships with a lot of these care managers, I will tell you it's a lot more stable in the aging life care manager world than it is in the caregiving world. And would you all care to comment on that?
Oh, I agree completely. Most of the people that work with us really care about, and like Joanne was saying, we develop such a personal relationship with the families and the individuals that we work with, that honestly, we don't have a lot of turnover. And we find that most of the people that work with us, including myself, love what we do. I can't imagine, and all the time I've been doing this a really long time, and it's kind of sobering thinking about it, but I love what I do. There's not a day I don't wake up and don't want to work with my clients. And I think, most of us go into this field with that feeling that we're able to impact so much and so many people and across so many areas that it's hard to leave. You don't want to leave.
Yeah.
I think too, Joanne, having both parts of the practice, I'm really curious, Joanne, to hear what your thoughts are on there. I think that as I'm trying to recruit and grow team members here at my own practice, just to meet the sheer need, but keep quality high. Like I'm not going to hire just anybody. And I think that's always our difficulty here. And so people stay in the profession because we're not entirely sure who's going to, who we can train up. But I'd love to hear your thoughts on that, Joanne.
I would say that our business, the senior care business and healthcare, that there is a lot of moving from place to place. I don't see that with the aging life care professionals. Like Karen said, my team, has been really, really stable for the past like 8 years. And I have some people who probably wanted to retire before now, but they're still there because I said I would work with this person, or it's a family member of somebody that I work with. They're not working as many hours as they did, but they're still so involved and connected and feel so, tied to their people. I came into care management because my business partner had owned a home care agency. And I started out as the director of nursing, and we have a lot of caregivers, and most of them are fantastic, and they do it because it's a passion and it's their profession. It's transient. Some people will go from one agency to the next for 25 cents more an hour. And there's just not more people coming into this job because you're caring for people who are helpless and want to communicate and just talk. I mean, it's so lovely to have a conversation with somebody who's, in their 80s or 90s or 70s, and hear about what their life was like at that time. And because we work with so many people that have dementia that you can't have that real engagement with, the little things that you do, I'm a nurse, so, I don't do hands-on nursing, but if you can help somebody get in and out of the car easily to take them to a doctor's appointment, or tell them about a really good cream to put on their feet, or just little things that you can do to make them comfortable, it's very rewarding from a nursing perspective. My years in the hospital, when as a nurse you follow orders, right? You have doctors who tell you, we're going to do this. With care management, we are empowered to like, people listen to us. People seek out what we think, because we learn so much about our clients and they learn so much about us. I know we have boundaries as far as, I don't tell you all the details of my personal life, but they can tell that they can trust you. So it is a really incredible job to be. Is it a hard job? It's really hard. Second to being a mother, it's really hard because it's 24 hours a day, 7 days a week. And do you like that call on Saturday afternoon or Sunday night, whatever? No, but they're calling you because they need you. So it is hard to find good people. I just think the caregiving piece is just a whole different animal compared to what we do as care managers. I don't know if that answered your question, but
No, that was great. Okay, more questions coming in here. Okay, let's see. Ainsley says, do you work alone or have a team? Well, all three of these practices have pretty large teams, I would say. Uh, oh, I knew this was going to happen. Ainsley, you get a gold star. What rates do you charge? Are caregivers included in on the team, or do you help hire separate caregiving agencies for your clients? Okay, so the first one is, these three care managers all have relatively large teams. However, Ainsley, there are solo practitioners, just like law firms and things of that nature. There's all different shapes and sizes, and that's why it's good to interview. So her second question is, what rates do you charge? So share with us a little bit about how most aging life care managers are paid, and how that works.
I would say that if you're looking to hire a care manager, it's good to look at depth of service in their agency. Solo practitioners are wonderful, and they usually maybe they'll have boundaries, like it'll take us 24 hours to get back to you, or they don't, they work more 9 to 5 type thing, or they charge certain fees on the weekends. So that is a consideration depending on how much intervention you'll need. If like you're hiring a care manager for your parents and you don't live in the same state, you might want somebody who has backup within their agency. For us, we charge hourly. We our rates are $175 an hour for our time. We also charge mileage and travel, and that is all based from our office in Fairfax. So from the time I leave the office to go wherever I'm going, if I'm going to the hospital or someone's house or to Brightview, it's the miles and travel to the place and back. And then once I have the client in my car, or I'm doing medication management or a visit, it's the $175 an hour. And that's from doing a new assessment. We just have one billing rate, and we bill in 15-minute increments. And we do have assistants, which we call helping hands. That's $65 an hour, and they work kind of with us if it's, there's some things you don't need to pay me $175 to take you to the eye doctor. I can use one of the helping hands. We do have caregiving, but we recommend other agencies. We can't tell people they need to use us, so we do refer to other home care agencies.
I would say too, it depends very much on the region where you are hiring aging life care professionals. I've seen spans across the country. On the coast, it tends to be a bit higher, but I think that's with many things on the coasts. I will say for my own practice, we have a range. $135 to $185 an hour, depends on who I have working on the case. So much like Joanne was just talking about, I might be the person who's with the client at the surgeon's office talking about this pending surgery, asking the questions about the post-care plan, or the prognosis, all of those things. But they don't need me to be, let's say, coordinating for the medications to be delivered to the house. I'm going to supervise that person, but I'm going to delegate that out to a team member who's going to charge less. And that just makes really good use of our skill set, our human resources, and the client's resources. Different than Joanne, we bill in 6-minute increments. So everybody's different.
Yeah. I think one thing I'd like to add also, I totally agree with Colleen and also Joanne. We are all a little bit different based on sort of our location, cost of living, whatnot. I know we bill in 10-minute increments. We have access 24 hours a day, 7 days a week to a clinician. So you're getting an expert with at least 10 years of experience in their field on call for you. You get a real person. That's a really big piece for me. We will never use AI. We will always use a real person because I think people deserve that. The other piece is we do consider documented financial hardship. So if people do provide us with that, we by all means will do a sliding scale for billing. If someone has been with us for a period of time and they convert to Medicaid, we will suppress the billing and continue care managing free of charge because that's our commitment to the family and the individual. And finally, we're covered by most long-term care insurance plans, and often under care advisor services is where you would look in your policy for that. And we can be helpful with coordinating the billing aspects in those areas.
Wow. Well, I have to say, we get this question every single roundtable, but the three of you provided the most thorough answer that we've ever had. I'll add one thing, and this for folks when you're talking about cost, and it's really easy, just like, holy cow, how much an hour? I'm not going to be able to afford that. One of the things that always comes up is the first consultation is free of charge. So that most care managers are going to get to know you for about 30 minutes, where it's going to be a give and take to see if it's a match to begin with. And then secondly, if you share that, hey, I'm on a budget, or mom doesn't have that much, or I'm going to be paying for this, I just need help with mom, that most care managers, elder law attorneys, daily money managers can be creative with their time so that they might be sharing ideas with you versus doing things for you to save the billing. Would you say that's kind of accurate, y'all?
I would say definitely. I mean, I field all the care management calls. I mean, they come into our office, same with, we have 24/7 live person answering the phone. I speak to every care management client, and you can tell when you talk to people that they may not have the resources. And because, we're all business owners, we have different rates. I give a lot of free information in that 30 minutes, sometimes 45 minutes, sometimes an hour. So, sometimes people that, you can just tell there's the clients are getting younger. And, so the people that are calling us, I spoke to a guy yesterday and I
I'm
could hear
getting
his,
younger too, which I think is a nice feature
good
of
for
being an
you.
aging life care manager.
I mean,
I'm not.
I could hear this son with like a toddler in the background, and he's asking me questions and, somebody told him to call us. So I'm like, well, I'm not going to make him sign a contract. I'm like, let me send you a couple places. Let me give you a little bit of information. I mean, there is value to our service, but we can give a lot of information. And like Karen said earlier, in 10 minutes, we can not solve everybody's problems. I give people references and then I say, like, try this. And if you still can't figure it out, then call me back. But, I think we all have a soft spot. We have to.
Oh my gosh. I think a lot of what we do is a labor of love. And I agree, Joanne, when I'm on call in the weekend and someone calls in at a crisis situation, before I'm worried about getting Kay to send them, our new client bundle, we're kind of digging in because no one calls us because they're having a good day. It's usually, something is happening. And when you're drawn to working in this field, you're someone who hears that call to action. I agree.
I would add to that, really that, across our great nation, there are area agencies on aging, and those were required by the Older Americans Act. And so every county in the nation has an assigned area agency on aging, and that is the design or the design structure, at least the governmental sponsored structure for that information and referral. I handle things a little bit differently at my firm, and that is we never give professional advice on that initial call. That 30-minute call is really, can we be helpful, and do you want us to help? As an alternative for people who are maybe not needing as much service, we offer something called care coaching. And this was really designed for people who were calling for a loved one, but they don't have the legal authority to make those decisions. So picture an adult son, maybe an adult daughter, whose parents never did their estate plan. They did not name a power of attorney for healthcare. So they hire Trinity to be able to help educate that adult son or daughter, because there's a care plan meeting happening at the nursing home, and they're about to send mom and dad right back home to the same environment that was unsafe, that put them in the hospital, et cetera. So we have started care, we call that care coaching, and we build that in 15-minute increments. I think the other thing that we've started, and I see that my colleagues across the country have also started, are professional consults. So that is a 60-minute paid consult where we are getting the facts of the case. And on those calls, we are giving professional advice. So we're not, it's a more in-depth call, and we are experts, and sometimes we can get so very much done in 1 hour. Does that always lead to a full care management case? No, but it definitely helps people in crisis to right the ship, or at least start righting that ship.
One thing I want to add to that, Colleen, that I hope everyone on this session will come away with is the key to aging well and maintaining your health well is through proactive planning. The more that you can be proactive in planning and doing like consults like through us or Joanne or Colleen, and finding a way to make sure that your questions are answered, or before you have a catastrophic, situation, you've looked at all the details. I think, you're going to have a much better path to navigate for, because like Colleen was saying, some of us use care management often. I have some clients that use us almost daily because they have complex care or they're solo aging. While we have other individuals that literally need an hour consult or guidance intermittently for a number of areas. And so, you know, we're able to kind of work within budgets, work within needs, work within the boundaries of what the individual needs. But it's important to be proactive. We plan for so many things in our life. We plan our outfits, we plan vacations, we plan what we're going to eat for dinner, but no one wants to plan for aging. And if you don't, sometimes, you know, plan for that, you may end up down a path you would not prefer.
Yeah, no, this is great. Let's see. Okay, I love how you've wrapped the well-being and quality of life philosophy around advanced planning. It's a scary topic for most people. Nice compliment there. Thank you. And okay, let's see. I'm looking at the clock. We've got about 7 minutes left. So I want to make sure that I check in with you all to see if there's anything today that you wanted to share with folks that you may have not had the opportunity to share. And it's also a last minute warning for anybody that's got a question that they might want to ask.
I would say,
Yeah.
I talked about it the last roundtable that I was on, but one of my focuses is to talk about early on with my clients is end of life planning. It's one of those things that people don't want to talk about. I didn't talk about it with my parents, but I talk about it with my clients. If not at the first meeting, maybe the second or third. Do you have, advanced directives? Do you have a will? Do you have estate planning? Do you want to be a do not resuscitate? Do you, those types of things. It might be that they don't want to discuss it now, but at least we kind of put it on the table. These things, end of life happens. It's not like on a Tuesday at 9 o'clock in the morning. It's Saturday night at midnight, and we don't know which funeral home to call. So that's my personal soapbox.
Yeah, we actually provide sort of the same kind of approach, Joanne, especially, looking across all those age areas, but we give all of our clients an advanced care planning packet with sort of some guidelines that we review and a template that they can use to start forming an advanced care plan. And then what we do is we tell them, take a look at it, jot some notes down and put it away if you can, and then take it out again and jot some more notes. And when you feel ready, let's talk about it at our next meeting. And so it's sort of a bit of a set but fluid process so that we have all those details in place about, funeral planning and all those pieces. And the big piece that we also kind of guide our clients on is, choosing good decision makers. These people are not really making decisions. They're acting on your expressed wishes. So thinking about that piece and giving it some time as a part of forming that advanced care plan that you can then keep tweaking and revisiting as that roadmap.
I think the one thing that I would add is that my big messaging is and has been for a very long time is sort of this crusade to stop using the word old because people don't use it in a positive way. And I recently did a talk about how it is that, so there was this wonderful 4-minute clip on CBS Sunday Morning. And so you guys watch it. It was with Jane Fonda and Ashton Appleton or Applewhite. And it was excellent. So I was asked to speak about that. And one of the things that I talked about, and I hope that, so many of the people listening are realizing that it's not over. And so don't acquiesce to this thing called aging. There's an embrace that is another option, and that looking at aging as this new frontier, recognizing that neuroplasticity is a thing. Your mind can change, you can grow, and that connection and community, creativity is all part of aging well and vitally, and that you're more than your body. You're more than the labels that society gives so many of us as we get older. And I just invite you to a different experience. And that's my 2 cents. That's my little soapbox.
I love it. And I copied the link to the Jane Fonda Ashton Applewhite um panel or Sunday morning. But if you for those of you who, if you look up Ashton Applewhite, she's got a really good TED Talk. And the thing, I think sometimes when we put celebrities, it's like, oh, look at this celebrity, how, you know, the age they are. And it's easy to be like, okay, it's Jane Fonda, movie star. I never lived her lifestyle, you know, but the all of us have a story to tell. All of us have purpose and opportunity. So I'm really glad we brought up that ageism piece for sure. Um, and somebody says, yeah, it's not over. 87 and 89. That's great, Anne Marie.
Yay.
But at the end of the day, you know, we talked about end of life. It's over when we're dead. Okay. And none of us know when that's going to happen. And none of us know how it's going to happen. So when we talk about end of life, we're actually talking about how we're going to live our life up to that day that is going to happen for every single one of us. So this is great. But if you got an AG life care manager as your wingman, you're ready for everything. Okay.
Hopefully, yeah. Yeah.
All right, y'all. This is great. Thank you to our panel. Number one, you guys were fantastic. I'll get this recording right up. But thank you to our audience. I'm always blown away at the great questions that y'all have and how every one of these roundtable discussions goes in a different direction. So we will be seeing y'all at the next one in about a month. And I want to thank y'all for taking time with us today.
It's a
Thanks,
pleasure.
Steve. Nice to see you guys.
Great to see
All
you
right.
guys. Thanks, Steve.
Thank you. Have a
Bye.
great day.